Well, for those of you suffering, and I mean suffer, with varicose veins or diseased veins of any kind, we have some really good news for you this morning. There's a new procedure that may help you, that's less invasive, less downtime. Terry Morrison is a registered nurse and co-founder of Morrison Vein Institute. She's going to tell us all about this newly approved procedure and the fact that you and Morrison Vein Institute has been involved in this whole clinical trial aspect of it. What is it called?
It's called VenaSeal.
VenaSeal, okay.
So that people can look it up. V-E-N-A, Vena, and then seal, because you're going to seal the vein.
Okay, this is a whole new procedure that we're talking about. What are we looking at here? On the left, we have what is a healthy vein, right?
And on the left is a healthy vein, and on the right, my right anyway, is a diseased vein. In other words, if you can see the blood going up and down, it's not supposed to do that.
Okay.
Veins are supposed to take blood towards the heart, and arteries are supposed to bring it back all oxygenated to our blood. But when we get venous disease, which people don't realize that varicose veins and spider veins can be a disease,
right,
then they get these floppy valves, and you don't need those veins in your body.
And they're painful.
Yes, and because it goes backwards, it sits and floods and leaks into your tissues and literally causes blood clots and various bad things to happen to you.
From there, it can just get, I mean, can go from really bad to worse.
Yes.
Right? Okay, let's talk about this new procedure. We have a photograph that's going to kind of help set this up for us, if you will. And this is the procedure. This is it's the newest medical glue gun. That's what I'm going to call it.
Yes.
It's literally gluing the vein shut.
Yes, it's called a medical adhesive. And it is like an implant. So instead of, in the last 12 years, we have had laser ablations and radio frequency ablations, all the things that they've had, closure fast, they all require heating up the inside of the vein to sclerose it or shut it down so that the blood can go to healthy veins.
Okay.
Now, if with one poke, like a patient feels like they're having an IV started.
So this is what's going into the vein.
Tiny little hole.
Right here.
Yes.
Okay, so this is in replace of what normally would happen.
Normally,
what normal procedures would you be doing?
Normally, patients would need more injections to numb the skin and to have a poke hole to put the catheters in, and then lots of little numbing local anesthetic.
Okay, and in this case, is it one treatment that will do it?
It will close whatever disease veins that you have inside. In other words, patients don't realize that progressive, if you close, let's say you have a small saphenous vein and a great saphenous vein, that's what they're called inside, not what we can see on the skin. If they're diseased, you close those off, whether it's with heat or this glue.
Okay.
But with this, you could do 3 or 4 different veins inside, put a little Band-Aid on it, we call it the Band-Aid procedure, and use this tiny bit of glue, and they call it an aliquot of glue, down the vein to shut it. And I want
to point out real quickly is that you and the Morrison Vein Institute were involved in this whole clinical trials. I mean, these are years and years of testing in the process of getting it to this point, and now it's available, right? Starting
last November.
Okay.
So everybody's up and ready now, and we've done over 26 segments. We did 50 before for this trials.
Okay.
But what's happening is people are opting out of their insurance because they don't want to wait 3 months like Medicare and insurance makes them wear these support hose.
Although your compression hose are very, very cute, you may not want to wear them all the time. But this is something that you know what, if this is a procedure that you think might work for you, you really want to do your research and check into this.
Yes.
It's brand new, and it may be exactly what you need. Let me tell you about a special offer, and it is a free vein screening, and this is just for the first 20 people who call in to the Morrison Vein Institute. Here's where they're located. They are at 6301 South McClintock Drive at Suite 115. It's in Tempe. And here's the phone number to call. It's 480-775-8460. Make your appointment or learn more at morrisonvein.com.